Sa panahon ngayon, ano ang alagang Pilipino? Ito ay alagang hindi makasarili. Alagang laging gumagawa ng paraan. Alagang nagkakaisa para sa bawat isa. Alagang handa sa anumang hamon. Alagang ramdam kahit saan ka man. Alagang maaasahan. Alagang nagbibigay ng solusyon at mga ngiti. Alagang busog sa pagmamahal. Yan ang alagang Pilipino. Alagang may husay at malasakit. Alagang nagbabayanihan. Nakikiisa ang UNILAG sa lahat ng Pilipinong walang sawang nagbibigay ng alaga para sa kalusugan ng bayan. Alagang tunay, alagang Pilipino. Sa panahon ngayon, ano ang alagang Pilipino? Ito ay alagang hindi makasarili. Alagang laging gumagawa ng paraan. Alagang nagkakaisa para sa bawat isa. Alagang handa sa anumang hamon. Alagang ramdam kahit saan ka man. Alagang maaasahan. Alagang nagbibigay ng solusyon at mga ngiti. Alagang busog sa pagmamahal. Yan ang alagang Pilipino. Alagang may husay at malasakit. Alagang nagbabayanihan. Nakikiisa ang Unilab sa lahat ng Pilipinong walang sawang nagbibigay ng alaga para sa kalusugan ng bayan. Alagang tunay, alagang Pilipino.
Hello, everyone. On behalf of BioOnco, as Specialty Marketing Division of Unilab, I would like to personally thank everyone tuning in today for joining us in this pilot run for our Akbayanihan webinar series. We are starting this series with this topic on coping with cancer and mental health amidst pandemic. But before that, let me tell you what Akbayanihan means to us in BioOnco and in Unilab. Akbayanihan has three root words. Akbay means hug or placing one's arm in another's shoulder. Bayani means hero. Ani or anihan means harvest or harvesting field. Akbayanihan is coined from the phrase akbay-akbay ng mga bayani para sa masaganang anihan, which simply means that when people are holding on to one another and acting as a hero for one another, then everyone will reach a place of abundance or a place where people can yield abundant harvest. Drawing inspiration, strength from the word Akbayanihan, we came up with a patient-centric webinar series that seeks to make lives better for cancer patients, addressing the often disregarded damage this pandemic situation brings to one's mental health, much more to a patient with cancer. And today, we are lucky to be joined by a distinguished speaker, Dr. Gia Season, who will be properly introduced by our equally distinguished moderator, Dr. Cristina Galvez. Dr. Cristina Galvez, or Dr. Chiki for us, is a medical oncologist. She is a consultant of St. Luke's Medical Center, Global City, and Veterans Memorial Medical Center in Quezon City. Dr. Chiki?
Good morning, everyone. So before we begin our webinar, I'd like to introduce our speaker today, Dr. Gia Season. Dr. Gia B. Season is a practicing medical doctor specializing in occupational medicine and is a graduate of the University of Santo Tomas. She herself is a breast cancer survivor for over 4 years now and is currently the Philippine leader for Live Strong Foundation and the National Advisor of the Youth for Mental Health Coalition. She's the former Chief Medical Officer of Global Telehealth Incorporated and co-founder of #HealthXPH, which promotes the responsible use of social media in healthcare, amongst others. She's currently the head of Makati Medical Center's Women's Wellness Center. She's a staunch mental health advocate and life and leadership blogger at her personal page entitled Sand and Stone, and her brainchild Unsaid Feelings, which serves as a platform where individuals can write and let their feelings with no judgment. Dr. Season also hosts her own digital series on CNN Philippines G Talks, which talks about life, love, and anything mental health related. She's also the resident doctor of Boys Night Out at the Magic 89.9 FM radio. Friends, let us all listen to this talk of Dr. Kia B. Season. Thank you.
Hi everyone, I'm Dr. Gia Season, and I'm a practicing doctor. My specialty is occupational medicine. I'm the head of the Makati Med Wellness Center. At the same time, I'm the advisor of the National Youth for Mental Health Coalition. Today, I'll be talking about breast cancer and mental health awareness since I'm an 8-year-old breast cancer survivor as we speak. So it was last February 2013 when I wrote this on my blog. I found out that the lump that made me wish I were not a doctor after 42 years of my life, since I knew based on its feel that it was not good. So just a short kwento lang on what happened. I'm really guilty of not being able to perform self breast exam, and thus when I found out that I had a mass on my left side, it was because my dad called me and then sa super long ng conversation namin, I had to rest my right hand on my left breast. And when I did that, I felt that it was like putting my hand on a table. So ganun siya katigas. And so I told my dad that I'll call him back. Then lo and behold, I had a huge mass that was fixed. It had all the characteristics of cancerous mass. And so the rest is history. Nagpamammogram ako, left mastectomy, and chemotherapy. So with which begs the question na I take physically care of patients as a doctor, but what happens when the role becomes reversed? So breast cancer and mental health is something that can't be separated. And during my chemotherapy cycles, that's when I realized the importance of maintaining your mental health, most especially during times when I needed extra support, etc. So it really can't be separated. And this is based on statistics from the World Health Organization last 2018 on the predominant cancers, both sexes in all ages. Breast cancer still tops the list. And the number of new cases, this is also based last 2018 pa in females, it's still breast cancer. And based on the Global Cancer Observatory, that's 2018 data published in 2020, when you look at your lower right, in terms of cancer, females, both sexes, it's still breast cancer. But this is, again, needless to say that breast cancer can happen in males as well. So just a little bit of a review, no? What breast cancer is. It happens when a disease in which cells in the breast grow out of control. So sa akin, it happened on my left one. And most cancers begin either sa ducts, dito yan, here. Ducts are inside, and then lobules are the one outside. And then there are two types. Basically, there's your invasive ductal carcinoma and your invasive lobular carcinoma. What I had was invasive ductal carcinoma. And when we talk about symptoms, this is based on the CDC. Really, number one is the lump, especially sa bandang armpit area. That's why it's very important later on When I talk about it, it's important to conduct a self-breast exam monthly. May thickening or swelling sa skin, any changes, nipple discharge can be a symptom. Any change in the size or the shape of the breast or pain, may, na pain in the breast can actually be a sign and symptom. So on this slide are both the modifiable risk factors, one that we can work on, and the ones to your right are the non-modifiable ones. Modifiable ones are pagka sedentary, so we really encourage physical activity because obesity can be contributory. Taking hormones, that's why before you take any contraceptive pills, we really have to consult a doctor. Uh, Drinking alcohol, etc. On the non-modifiable side is the genetic uh, predisposition. So we really have to watch out for these and be proactive in terms of health. And so these are the five pillars of prevention. I know it may sound so basic, but it forms part of the advocacy. So keep a healthy weight, exercise regularly, refrain from too much alcohol and smoking, consult your doctor regularly, and of course, breastfeed children if possible. And here's a word about the mammogram. Usually, it's done around 40 years old and above, and it can detect even the littlest of masses in the breast. So I mentioned this earlier on how to perform a routine self-breast exam. So step one, but just not actually a disclaimer, but just an advice that you conduct a self-breast exam after your menstruation. So kasi when you do it before, you may, because of hormonal surge, you may actually detect a lump na hindi naman lump. So do it after. And make sure that you look at your breast in the mirror again with arms by your sides and then arms raised. Then number two, feel your breast but both lying down and standing up because there are some lumps that can't be felt when you're standing up. So and when you do a self breast exam, it's you have to start from the outside, going to the inside, and please don't forget to palpate your armpits as well. So let's go to understanding the psychosocial needs of people living with cancer and as well as their caretakers. I would say uncertainty is number one because up until now we wouldn't really know when it's going to recur, when it's going to come back. But I'd like to believe it won't na. Then of course loss of function in some. Um, a year or well during the first year of my mastectomy, I really had a difficult time lifting my left arm, but slowly it had it gained its function back. And when you look at the statistics in between the numbers, no, mental health and cancer, 8 to 24% of people with cancer are at risk of developing depression, and three times in terms of rates of major depressive disorder compared to the general population. And of course, yeah, pagka younger, uh, mas at greater risk based on Park and Rosenstein's study last 2015. So let's talk about fear of recurrence. This always happens every year whenever we get our surveillance exams, annual exams. It really is a dominant and prevalent symptom of after cancer or even during. And it may come in various forms. Andyan yung ayaw mag-visit ng doctor, hypervigilance, you become extra sensitive in terms of kahit konting symptom lang, you think it's coming back. And of course, financial wise, it can be draining. Now, this stress is a multifactorial unpleasant emotional experience, and it's the sixth vital sign in cancer care. And here are the stages based on the National Comprehensive Cancer Network. Here are some of the phases where one can experience distress from the time he or she is diagnosed to end of life. So when it pays to have this uh, mentality of having a high index of suspicion because it pays to be again proactive about it. And when we speak of anxiety disorders, the right, but on your left are the presenting symptoms. It can cause tension, palpitations, etc. And in terms of risk factors, more common in the younger age, living alone, and a diagnosis of other cancers like lung cancer and melanoma. And depression is very, this is how it presents, usually presents, although this is not a diagnostic talk. Low mood, changes in sleep, difficulty concentrating. Now, a trigger warning that suicidal thoughts can happen, and it can manifest as physical symptoms as well. So, when we talk about supporting people living with cancer, when we look at the cancer patient in the middle, there are a lot of factors: mental health, social work, counseling, and in whatever faith you believe in. Spirituality is very important. And these are evidence based approaches for cancer patients in distress. Remember, distress is the sixth vital sign in cancer care. So you have supportive groups in terms for psychotherapy, cognitive behavioral, and cognitive existential therapy. And we have mindfulness, that's very important. And if it really gets really bothering, we may have to go the approach of psychopharmacological intervention. And psychosocial support can come in various ways. Establishment of rapport and trust, being physically present. For me, that was really very important. And it also pays to have a multidisciplinary team, meaning to say it's really a team effort, no? One makes between doctor, nurses, family, friends, even, and being mindful of verbal and nonverbal communication techniques matter, and addressing day-to-day issues one day at a time matters because it may affect one's quality of life. And the list to your left is from ESMO, the European Society of Medical Oncology, and it kind of enumerates the patient's needs. No? We have changes in family and relationships, sexual life after cancer, having kids, especially when diagnosed during the childbearing days, return to work and finding a job after surviving, managing finances. Of course, it really drains you, and finding new hobbies and interests. And as mentioned earlier, spirituality is one of the strongest predictor of social well-being. So it kind of helps, no, addressing also the emotional and especially the emotional well-being of both patient and family, and providing hope, no matter how the shape of hope comes in. This is where reassurance matters. And in terms of in the healthcare practice, we also have to balance truth telling with nurturing hope. So ayaw naman natin magbigay ng false hope. So what we're talking about is that the reassurance that you can do it day by day. There's always hope no matter what, and that uh, you're there anytime he or she needs you. And when we talk about social support, it's both instrumental or expressive and emotional support as well. And speaking of mental health, since we celebrated Mental Health Day last October 10, these are actually parang common tips on how to deal also with individuals with mental health problems or even mental health challenges. So let's all remember that all feelings are valid. Never assume that you know what the person is feeling, even if you had a similar experience. Also, don't assume that you know what a person can or can't handle. So lahat tayo capable of handling certain challenges. It's just that we handle them in different ways. And that don't attribute rin naman every behavior to a mental illness. So it's more of really listening to the person and allowing the individual to vent out. Demonstrate understanding and support, however, but set reasonable expectations because you may also carry your own challenges yourselves. And of course, respect confidentiality. And again, I'll always go back to reassurance. This is a picture of my family, and this was taken roughly around 6 months after I had my last chemo cycle. And for me, they formed a huge part in terms of my recovery and my keeping my sanity and my faith in being able to fight cancer 8 years ago. And in my whole journey, one thing I learned is that life is a balance between what we can control and what we can't. One must learn to live comfortably between effort and surrender. So, with that, thank you so much and good day.
Thank you, Gia Season, for that really wonderful talk on mental health issues for the cancer patient and also for the family and the caregivers and those around the person who truly love the person with cancer. Although Dr. Gia Season cannot be with us today, we have an equally competent resource speaker with us, Dr. Lisel Trinidad Fulgencio. She completed her residency in the Department of Psychiatry and Behavioral Medicine at the UP Philippine General Hospital, as well as sleep medicine course in cognitive behavioral therapy and sleep consultancy in Edinburgh, Scotland. Ayan, kasi issue talaga yan ng mga madaming tao ngayon. And currently, she's a clinical associate professor at the UP Philippine General Hospital Department of Psychiatry and Behavioral Medicine. She's a consultant for general adult psychiatry at Health First, Soho Central Shaw Boulevard in Greenfield, Mandaluyong City. She's also the section chief of psychiatry for Marikina Valley Medical Center and is a professor at the Emilio Aguinaldo College School of Medicine. Good morning, Lisette, Dr. Lisel. Good morning. So, good morning, everyone. So, I think we're ready to accept now any of your questions. I believe meron tayong mga maagang nagtatanong na. So, we have with us a lot of, we already have several questions for you. Dr. Lisel, are you ready?
Yes.
Any words first for our viewers before we start with our Q&A?
Oh, okay. Dr. Gia gave us a very good lecture, a look into how it one goes through when one is diagnosed with cancer. Okay, but let us remind everyone that how we deal with the diagnosis and then how we go through the journey is also something that is unique for everyone, no? Wala po talaga siyang specific pattern that we follow, so we will have to respect each other's space. Yun yung pinaka-importante doon, no?
True.
We
Yeah.
respect each other's journey.
Very true. So we have our first question. So mabigat na siya agad. First question pa lang. So I know, syempre, cancer in itself, when you have that diagnosis, it's really, it's an issue, right? So how do we recognize that that the cancer patient, or maybe even the family members of the cancer patient, are having symptoms of anxiety or depression? And as a follow-up question to this, how can they already alleviate the symptoms from the start? And when can you advise them to already seek professional consultation?
Okay, thank you. That is actually a very good question. Okay. Number one, what you need to do is that remember that for everything that happens in our lives, especially those that we didn't anticipate, there is a corresponding psychological reaction, di ba? In other
Mhm.
words, talaga hong meron talagang reaksyon na makukuha tayo. So yung atin pong nararamdaman, no, will also depend on kailan po natin na-encounter yung event na yon, no? For example, if you were previously diagnosed, of course, no, it's perfectly understandable if that person feels sad, if that person mourns, no, for example, no, for unexpected loss
Mhm.
of function for that time, no. And of course there can also be anxiety reaction reactions, no? Kasi of course there is
Mm-mm.
uncertainty to it, no? Lalong-lalo na po pagka alam mo naman na this is something, no, that will require treatment, no? So in the beginning, I think, no, kung meron pong anxiety or depression, it's understandable, it's valid. Okay? Now, when do we say that there is a need for further evaluation? No? For example po, if what we feel becomes um, uncontrollable in the sense that, for example, because of the anxiety, no, the fear prevents us from seeking treatment, no, that is one, no. For example, I have been hearing meron ho kasi na halimbawa stage 1 or stage 2, no, pero because of the anxiety, no, fear of the chemotherapeutic agent, no, sabi nila ayoko na kasi narinig ko ganito yung sabi, no. So probably that will be a cause for evaluation, no? Just to try to understand where
Yeah.
the refusal comes from, no? That is one, okay? And then if it also becomes a cause for you to be unable, no, to do your tasks, no? Usually po kasi, 'di ba? We have our own task, be it a homemaker, no, a worker, no, a partner. So if because of the sadness, because of the anxiety, it prevents us from doing our regular activities, then an evaluation is also warranted, no? So usually po ganon yung gusto nating
Mm-mm. Yeah.
tingnan, no? So pag nafi-feel po natin that there is significant deterioration, no, that is a reason for evaluation. Now, in the beginning, no, ano ho yung importante, no, na itatap natin? I think the very important thing is psychosocial support, no. Kasi
Yeah.
sabi nga ni doktora, physical presence matters, no. The very fact that you will not be alone in this journey that you don't know how long it will be, but when you are comforted, no, with the assurance that they will be there, no, the probably po mababuffer, no, yung blow to the
True.
yung psychosocial reactions, mababuffer yon significantly.
Ayun. Thank you, Dr. Elisel. Napansin ko nga yung first stages, yung sometimes yung ibang patient, hindi nila na-realize yung family member nila na may cancer, depressed na pala. Kasi it's not necessarily, di ba, yung they present na malungkot. Often, napansin ko din, tahimik sila, highly irritable. Sometimes, yung sadness nila is in the form of anger, or di ba may mga ganun eh. Sometimes you think hindi mo talagang makikita na may yung they will always tell you na they're okay, they're fine, they want to be left alone. Pero often, di ba, that's not true yan. So it's not true that often they want to be left alone. Pero ako napansin ko din, tama ba Dr. Elisel, napansin ko yun sa ibang patient na yung when we say support, you don't have to be with that person na may cancer, na may pinagdadaanan, at lagi kang may sasabihin. Sometimes, yung presence mo lang, yung wala ka talagang sasabihin, and then you just wait for that person to talk to you voluntarily. Yung just the mere thought, basta alam lang niya na you're there for her or him, not really necessarily na, kasi di ba, napansin ko at my patients tell me kasi na ang dami talagang tao yung nagte-text, tumatawag, or binibisita siya, well-meaning, or sometimes nakakadagdag sa anxiety nila. So, may mga ganun kasi, what can you advise yung mga ganito na bakit kaya, even if well-meaning tayo, sometimes nakakadagdag pa tayo sa pinagdadaanan ng tao. Di ba may mga ganung issues sometimes?
Okay. I think po that could also be explained by the personality, no, of the patient. So case to case talaga 'yon kasi there are some people po that when they are diagnosed, no, with a particular disorder, no, it really takes some time for it to sink in. 'Di ba? Kasi yung kailangan po doon, ipa-process mo rin 'yun for
Yeah.
yourself, no, to try to understand what is happening. Yung problem kasi doon, no, is if people start, no, to ask you how are you, how do you feel, 'di ba? Paminsan ho, mahirap ho ang naririnig kong sinasabi nila is, doktora, kasi na-overwhelm din ako bigla, no, doon sa
True.
mga pagtanong nila, ano yung sasabihin ko, how do I explain, no? So probably po, no, hindi nga, tama kayo na hindi naman kailangan all the time may sabihin, no? The very fact na you just have to express, if you need help, no, I will be here to listen. Listening is in itself a form of support, no? So yun ho yung isa sa mga makakatulong sa atin. Hindi kailangan minsan pag marami pa tayong sinabi, minsan hindi na, although well-meaning nga, no, it actually affects, it actually becomes counterproductive, no. So let's take it step by step, no. Respect the space, but let them know that you will be there for them. I think
Mhm.
yun yung pinaka ano yun yung importante, no. Respect the space and then just be there.
Tapos meron tayong isang unusual question ngayon. And I think very apt for what we are going through sa pandemic. Can the pandemic trigger a hypomaniac episode in a bipolar or depressed patient?
Oh, okay. Sige po. Let's just start first with the pandemic. Of course, no. You have to remember that the pandemic, no, ang regular psychological reaction is that it will definitely bring about a lot of anxiety, a lot of distress, no. Kasi hindi mo alam when you will have it. How, 'di ba? Kung kailan darating din 'yun from you, lalo na kung ikaw din na patient, no? Alam mo that you are very vulnerable. That is why mag-i-increase yung anxiety. Depressive symptoms will also increase because we are restricted, no? The things, yung routine po natin was actually disrupted as well. Okay? That is why it can trigger a depressive reaction but not necessarily a depressive disorder. Okay, now, the problem is because of these psychological reactions, for those who have pre-existing conditions, no, yung dati na hong may sakit, no, or yung dati na hong mayroong pinagdadaanan, mas magiging intense yung reactions. Okay, that may be the reason why, no, somebody will go into a full-blown depressive episode, no. Now, yung tanong po kasi doon, probably they have a relative, no, who was previously diagnosed with bipolar, no. Ang bipolar po, it's really a cycle of depressive and manic episode. Yes, the pandemic can precipitate one, pero hindi lang ho yung pandemic, no. Any stressful situation can actually precipitate a hypomanic episode.
Yeah. Yan. Pag nag-hypomanic episode ba yan, kailangan na ba yan mag-seek ng professional consultation? Or pwede pa yan ma-contain or matulungan pa ng mga supporters ng patient?
Oh, usually po kasi, what are examples, no, of hypomania, no? One is definitely decreased need for sleep, no? Yung dati ho na natutulog ng 7 hours, 8 hours,
Mhm.
suddenly sleeps 3 to 4 hours, and then ang daming energy, no? And then you also see a person who has started to actually do various things, no, lahat simula pero hindi natatapos, no. And of course, the most bothersome is being very impulsive, indulging in activities,
Mhm.
no, na halimbawa po ay very painful ang consequences, shopping sprees for example, no, into sports, no. So kung ganun po ang behavior, lalo na ho kung nagiging very impulsive, I guess that's really an important time to seek
Mhm.
treatment and evaluation.
Okay. Yan, dahil si Dr. Lisel ay isang sleep specialist, I've noticed, lalo na ngayong pandemic, and especially for a cancer patient, whether survivor or ongoing treatment, sleep is really something na they are having difficulties. A lot of them will come to you, and yan ang number one na isa sa very important issues nila, na they are not able to sleep. But when you ask them if they're thinking of something, they will deny. So I don't know. Pero I know it's treatment related initially. Pero how can we, ano yung mga pwede nilang gawing mga things para or processes para eventually they will be able to achieve quality sleep also.
Okay. Sa atin pong lahat, we have to remember that sleep should be a habit that has to be prioritized, no? Unfortunately for most of us, no, sa dami ho ng gusto nating i-accomplish, yung sleep yung parang hindi natin napaprioritize, no? So ngayon pa lamang po, for everyone, healthy or not, sleep should be a priority. Okay? Therefore, we need to practice yung tinatawag po natin na good sleep hygiene. Okay? How is that, no? Paano po yun ginagawa, no? Number one, kasi hindi ba when we start to decide what time we wake up, di ba ganun yung ginagawa natin? My day will start dapat at 7 o'clock. Di ba may ganun before? Kailangan din po, we have to consider how much sleep do you need, no? So for example, if you want to wake up at a particular time, no, then set a definite sleep time, no? For example, you wanted to sleep 10 p.m., no? Ang problem po natin ngayon is the world doesn't no longer sleeps, 'di ba? Nung time natin when I was younger, 9 p.m. second news. It tells the child in you, you have to stop, 'di ba? You
Yes.
have to stop what you're doing kasi dapat ka nang matulog. But now, we have Netflix. Dati cable lang eh, 'di ba? Yung cable ma-realize mo paulit-ulit siya so hindi na mawawala yung attraction. But now we have cable, we have YouTube, no? So my advice is, no, if you want to
Yes.
sleep at a particular time, no gadgets, no TV 2 hours before your sleep time, no, because the TV po is activating, no, so even if you decide to turn it off, hindi naman po agad magka-quiet down yung brain, no, so it's important, no, because the sleep habit po has to be a regular sleep time, no, whether weekend or weekday. Unlike sa atin kasi, no, before ang tendencies natin pag weekday, weekend, no, mag-e-extend tayo for at least 3 hours, 2 hours, 3 hours longer, no? So one, yun. Kailangan po yun. Regular sleep time, okay? And then, of course, coffee, if you are into caffeinated
Yeah.
drinks, no? No coffee beyond 4 or 5 p.m. Kasi po, hindi naman yun agad mawawala. Mahilig pa naman po tayong lumabas for a coffee in the past, di ba? At night, no? So that will also be a problem, no? And then exercise, if you want to exercise, at least not very close to bedtime, no, because when you exercise you also release epinephrine that will actually be activating the brain, no, so at least po when you decide to exercise, either place them in the morning or at least 2 hours prior to the sleep time, no.
Yeah.
And then you also have to observe yung temperature po in the room where you will be sleeping, no? Because if the temperature is very hot, of course mahirap matulog. If you are sleeping po, no, an air conditioned room, no, be watchful of the temperatures because you have to remember the body temperature drops, no, in the middle of the night. Kaya ho yung iba sa atin nagigising nanginginig, 'di ba? Nilalamig tayo. That's because, no, the body temperature drops and then you also have a very cold
Yeah.
environment, no. So those are important things to have that you have to consider. Of course, no liquids, no alcohol, no. Lalo na po prior to the sleep time, no, kasi of course what you put into the mouth has to also go out, and every time you walk you also activate your wakefulness, no, kaya ho hangga't maaari po, no, you make sure that you attend to the call of nature prior to going to sleep, no. So ganun ho muna ang pwede nating gawin, and of course environmental noise, no, kung ang room ho ninyo is facing a national road, no, you have to have an earplug with you for you to have better sleep, no. So if nagawa na po natin, no, yung good sleep hygiene practices na yun, and then it becomes still the problem is hindi pa rin po tayo makatulog ng maayos, then it's time for an evaluation as well.
Sige, I have one last question na lang kasi malapit na ang Christmas and I've noticed na even for those people na walang cancer special events like birthdays, Christmas, it actually triggers one's depression. And I think lalo na kung you have cancer, for some reason, mga New Year. So what can you advise patients na before nila maramdaman ito or yung loved ones nila that surrounds them para they can agad support their loved one na para hindi kailangan mag-go through a severe depression during this special season ng Christmas natin.
Okay. No, this early, thank you for that question. This early, I am reminding all my patients, no, even non-patients to actually condition your mind that definitely this year's celebration will be different. No, alam niyo naman po 'yun because of the restrictions of the COVID. So thinking about it, no, yung anticipating that it will be different, no, makaka-prepare na po tayo nun psychologically, no, na magiging different yung celebration, no. Bakit rin po tayo mas nagiging sad during special occasions like this, no? Because lalo na ngayon, no, you'll realize 1 year has passed and you are actually far from what you have set, no, in at the beginning, no. Pero ang usual po that will be helpful, no, probably is to also set time, no, and express things that we can be thankful for, no. For example, kasi minsan ho, no, sinasabi, naririnig natin 'yon, no, that there are always a lot of things that we can be thankful for, no. But it's also important to verbalize them and share it with a group of people, no. For example, 'di ba Thanksgiving in the US, but in our family, no, we have prepared also an activity that will tell you what are the things that you are thankful for, no. So pwede hong ganon yung mga activities, no, so that you can verbalize, no, not only the things that you will be thankful for, pero at least, no, ma-commend mo rin yung mga taong important sa iyo that you are thankful that they are around, no. So important 'yon, no. No matter how difficult the situation is, no, let's help each other count our blessings, no. That's what we can do, no, to be happy, no, to actually see the better side of things and be kind, no. Be kind. Why? Because yung kindness po works both ways, no. I am happy because I have given you kindness. The recipient of that kindness will also be happy, and hopefully that kindness will be passed on to people, no. So that can help us go through a difficult time, especially during the holiday season.
Ayan. So, ito na lang, very last, kasi naalala ko may isang important thing. Kasi di ba kami lahat as oncologists, we advise our patient na during treatment, kasi there are studies now that it really shows na if a patient has a positive attitude about her diagnosis, her entire disease, chances are going through the treatment will be a breeze and there will really be fewer toxicities of the treatment. But syempre, when we advise them to have a positive outlook, it's easy said than done. Pero what are the tips that you can give our viewers na how they can have this positive attitude? Like, kasi madali siyang isipin, but yung processing it para you can have that positive outlook in life, what are the steps that you can, or tips which you can tell our viewers right now?
I think po, with what we're going through, we have to take things one day at a time, no? One day at a time, one cycle at a time. Kasi ho, yung concept ho na I will be taking this for 6 times, 'di ba? I will be taking this for 12 cycles. It provokes a lot of anxiety, no? So ang usual ko po no na sinasabi is important no, truth telling, alam nat ng tao no, kasi laging question yun eh. It's important that the person who will go through the treatments knows what ano yung kanyang pagdadaanan. That's important no, and remind them that we will be going through the days of the treatment, through the journey, one day at a time, with a reassurance that these people will do their best no, to be with them throughout the journey.
Thank you. And so, with that, Dr. Elisel, any last few words for our viewers as we end this webinar?
Oh, thank you no for inviting me to be here no. And I am happy that we are really actively talking about mental health no.
Yes.
Okay, but we have to remember no, 2020 may not be a very good one for all of us no. Definitely 2020 is a character building year for us no. The important thing, ang take home po sa akin is it's not a time to actually yearn for what we don't have, but it's a time to appreciate what we have no. So we continue to count our blessings. The very fact that we are alive today is a blessing in itself. So thank you, thank you.
Thank you. So, to our viewers, thank you again for listening. And again, it's also equally important to take care of our mental health aside from our physical bodies. And yes, during these times, especially for our cancer patients, during times of pandemic, what you are going through is valid. It's okay. You can process it. But yes, at some point, please talk to someone. Choose to be happy. Choose to be grateful. Stay safe. Thank you, everyone.
Again, on behalf of BioOnco, we would like to thank our esteemed speakers, Dr. Gia, Dr. Chiki, and Dr. Lisel, and all of you joining us here today. We truly hope we are able to support you every step of the way. We are diligently working with your doctors to bring you quality and affordable cancer care. Please feel free to reach out to them for any details on programs that may help you. And we look forward to seeing you again in our next run. Thank you, everyone.
Sa panahon ngayon, ano ang alagang Pilipino? Ito ay alagang hindi makasarili. Alagang laging gumagawa ng paraan. Alagang nagkakaisa para sa bawat isa. Alagang handa sa anumang hamon. Alagang ramdam kahit saan ka man. Alagang maaasahan. Alagang nagbibigay ng solusyon at mga ngiti. Alagang busog sa pagmamahal. Yan ang alagang Pilipino. Alagang may husay at malasakit. Alagang nagbabayanihan. Nakikiisa ang Unilab sa lahat ng Pilipinong walang sawang nagbibigay ng alaga para sa kalusugan ng bayan. Alagang tunay, alagang Pilipino.